Sports Medicine. Ladies and gentlemen, welcome to Season 2 of Sports Medicine Special Edition. I'm your host, Carlos de Los Angeles, CPT, NASM CES, CNC, VCS, and DotFit Certified Practitioner. And today, I got the pleasure of a very special guest. Wow, one of my favorite teachers and contributors to the NASM Academy. She is Functional Podiatrist and Human Movement Specialist, Dr. Emily Splichal. Welcome.
Hey, thank you. That was an awesome intro.
Thank you so much. We're glad you're here with us today. Appreciate your time.
Of course.
All right, so let's get it on. Let's talk about the human foot and its functions, and also the most common dysfunctions that you see with your patients and your clients, because you also you got a kind of like a hybrid fitness and patients in your clinical level also?
Yes. So I am a podiatrist, as you had said, but I'm also been in fitness for over 20 years. So I have a great appreciation for human movement, for what a lot of the trainers and coaches are doing and seeing with their clients. So when I look at the foot and teach about the foot to trainers or to my patients, is I want them to appreciate that our feet are our body's foundation, which means that it's our foundation to body alignment, posture, but it's also our foundation to movement, which means that it is reading the ground, sensing the ground, and then reacting and adjusting to every step that we take. This is why I'm a huge proponent on natural footwear, natural foot function, functional feet. I try to get people out of orthotics and supportive shoes if I can, just because I want them to really connect to their movement. And it's difficult to do that in supportive, restrictive structures. So we really want to think about the foot from that sensory, functional perspective. And then when we potentially get a disconnect between our feet and the ground, or our feet and the rest of our body and our movement, that's where you can get literally every itis that I would see in my office: plantar fasciitis, Achilles tendonitis, bunions, hammer toes, neuromas, things like that, that a lot of people associate it with foot pathology or foot problems.
Amazing. I read on your book, like we lose the sensitivity, proprioceptive sensory qualities in our feet. Like we got so many sensors down there, and like all this caution and all this footwear, it's actually detrimental.
Yeah, so we have thousands of nerves in our feet, but hundreds of them that deal with movement, because there's other nerves. But the ones that deal with movement, it's interesting when you look at the research, they show that the peak sensitivity of the nerves in your feet is the age 40. And then by the time you're 70, you need twice the stimulus to create the same response.
Wow.
What that means is that if you have thick cushioned shoes on, and let's say you're 70 plus, that further contributes to the sensory disconnect, which leads to falls, instability, things like that. So I try to get everyone of every age to think about their feet and footwear, but really that baby boomer population, that I call it barefoot baby boomers. Like I want to actually get them barefoot and connecting to their feet. But yes, the brain or the nervous system, I'm sure a lot of people have heard the saying, if you don't use it, you lose it. I'm saying, right? That very much applies to the feet as well. That if you're not using the muscles, if you don't stimulate the nerves, they start to get weaker, they atrophy. Some of our muscles can denervate, which means you lose the innervation to them. And that's because of disuse or that disconnect because of footwear.
Okay. Is it similar to kind of when we got weakened muscles, underactive muscles that we talked about in the CES, the corrective exercise? Like these muscles that are not firing enough?
Yes, so you could say they're either not firing, not engaged, maybe they're slower. So when I speak about movement and movement imbalances that I might see, whether this relates to the feet, to the core, to the shoulder, whatever it is, I talk about time. So timing, right?
Okay.
You want to think about how quickly is that muscle engaging? How quickly am I sensing the ground? How quickly do I react to X, Y, or Z? And that's really what dictates how we control our movement, our injury risk, our performance, things like that. It literally is about timing in the human body.
Perfect. Vibration is our perception of impact forces.
Yes. So the nerves in the bottom of the feet that we referenced, so the ones that deal with movement, the nerves that we said there's hundreds of them, that their peak sensitivity, right? So they're called mechanoceptors, special nerves. And these mechanoceptors are sensitive to different stimuli. There's 4 main stimuli, where there's texture, which is 2-point discrimination.
Okay.
Think of like Braille, or if anyone is familiar with Naboso, 2-point discrimination.
Okay.
The second is pressure. The third is skin stretch. So if anyone is familiar with like kinesiology tape, right, the colored bright tape,
Yep.
that activates skin stretch. And then the fourth is vibration. And vibration actually makes up 70% of the nerves in our feet. 70%.
Wow.
What vibration is, or where we encounter vibration, like you said, it's impact forces. So that means every time our foot hits the ground, we experience vibration, ground reaction forces, impact forces, foot striking ground, all of that is vibration. That is 70% of what our feet are sensitive to. So that's the most important stimuli that's coming in. Cushion in our shoes takes away that vibration. We use vibration to know how hard we're striking the ground, but we also use vibration to maintain balance, which is really cool.
Yeah, and preventing falls in the older adults, as you just mentioned. But I read that actually before it was believed that the cushion was actually going to help with the impact, with like mitigating that impact, and it's actually increases the because we have a perception that we're hitting the ground like a lower let's say lower force, and actually makes us step harder every time we walk.
Yes, exactly. So your body wants sensory information. So I often say when I speak to my patients or I teach workshops is that sensory guides motor. So sensory comes in first, then motor, right?
Awesome.
So if you want to improve the way that you move, you have to look at the quality and quantity of sensory information coming in. If you don't get enough sensory, you're going to try to seek it out in other ways. That's how you said you're going to hit the ground harder, right? Mm-hmm. And then we also don't want to have, poor quality information coming in, because then the motor out is poor. So yes, cushion in shoes takes away our sensory information. So we try to override that by striking harder.
Another thing really interesting that I read on your book was about the AGEs and how this also affects our, let's say, in our fascia, especially in our fascia and tendons. So what exactly, for people to understand, are the AGEs, advanced glycation end products?
Yes, I was just going to say what that abbreviated for, but yes. AGEs, or advanced glycation end products, it's a type of free radical. And I think that everyone is probably familiar with free radicals, right? That they think of free radical as how we age. You might have heard the term oxidative stress, or you could say inflammation. All of those are markers on how our body ages. So whatever it is that's causing you to age, the bottom line is that you have too much oxidative stress or inflammation in your body. One of those might be AGEs. Now, AGEs are formed by elevated blood sugar.
Okay.
So it's a free radical from glucose. And so some people might think of diabetes. Diabetes is a situation where they have elevated blood sugar or difficulty controlling their blood sugar, which means they're going to have this opportunity for the blood sugar that's just kind of hanging out to oxidize. And when it oxidizes, it creates an AGE. Now, why this is important to people who are listening and movement, and when I teach patients and trainers, is that AGEs go after collagen. And collagen is in your skin. Collagen is in your tendons, it's in your ligaments, it's in your fascia, it's what surrounds your blood vessels. Blood vessels obviously create circulation to the nervous system. So this is where you start to see a lot of the breakdown of the body when you have too much AGEs or uncontrolled blood sugar. Diabetics, again, easiest analogy, but it happens to everyone, have a higher tendon rupture rate than someone who's not diabetic. They have poor wound healing, which a lot of people hear about, don't get an amputation or an infection, where if you have poor collagen, that's what allows you to heal a wound, and that's compromised in those that have diabetes. And then neuropathy, right? Retinopathy, things like that, it attacks those areas as well. So my biggest message is control your blood sugar.
Wow. Unbelievable. Really, really interesting. Okay, now let's dig a little bit into the foot to core integration. I was fascinated with the explanation you gave in your book on Barefoot Strong. We're going to be talking about that momentarily. But what about the deep lateral rotators? I didn't know about that. You compare them similar to the rotator cuffs in our shoulders.
Yes.
And how all the forces we perceive off of the ground all the way up the kinetic chain, and how it travels to the pelvic floor, diaphragm. It's unbelievable. Then the psoas major, and finally the glutes activate. We always think about the major muscles first, but we usually don't think about these small, deep muscles that are just as important, or I'm pretty sure you're going to say even more important.
Yes. So this is another example of how timing is very important. So the timing of which muscles contract first. A lot of people will think about, oh, I need strong glutes, so I have to train my glutes, versus thinking, oh, if I want strong glutes, I need to train my core to be stronger and faster. So that's really what we're referencing. Now, the core, the deep core that you were mentioning, the muscles, all of them are fascinatingly connected to each other, which means that this connection is your deep hip, which, like your rotator cuff, it's stabilizing the hip joint, the femur and the socket. That blends into your pelvic floor. Your pelvic floor, which is the base of your pelvis and your deep core, blends into your diaphragm, which is the upper part of your core. And then coming off of your diaphragm is a muscle called the psoas, which is a really important muscle for rib cage pelvis stability. A lot of people think of the psoas as a hip flexor, but it's actually more of a stabilizer of the pelvis and the rib cage. So all of those muscles are connected to each other, and all of those muscles are also connected to your feet. So your foot is a activator of the deep core muscles when you learn how to engage it the right way. And that's short foot. So
I was going to say that. Oh, okay. So the short foot exercise that you so well explain all the time, and how to integrate that and know how to also engage the pelvic floor muscles, that actually works for that, right?
Yes. So short foot, for those who are not familiar with it, you're essentially pushing your toes into the ground. It's best felt standing up. So if anyone is listening and they're trying it, I would say stand up and you just push the tips of your toes down into the ground, kind of thinking like pushing the toenails down. And when you do that, you create a little bit of tension in your feet. Now that tension in the feet also connects and creates tension in the core, so that it's a myofascial connection between the foot and the core. And the reason that that is built into our body is that the purpose of our nervous system is really to move. So movement shapes the nervous system, and then the nervous system is for movement. So it's kind of this interdependent relationship between movement and the nervous system. So our nervous system, we need to move. To move, we have to stand up in gravity. which means we have to control our center of gravity, which is our core. And then we have to connect to the part of our body on the floor or the ground, and that is our feet. So that's why feet and core are so integral to the way that we move.
Awesome. Awesome. Impressive. Now, what is Barefoot Strong? For people who don't know, what is Barefoot Strong?
Well, Barefoot Strong is a hashtag that I made, but it's also my book, and it is a philosophy. So my book, Barefoot Strong, really is about unlocking movement longevity, which is everything that I speak about is really built around the anti-aging application towards movement, hence movement longevity. Now, Barefoot Strong is a lifestyle. So I believe it's a lifestyle. Does not mean that you are walking around everywhere barefoot. You don't wear shoes, you're literally 24/7 barefoot. That's not what it is.
Okay.
It means more that you've connected to the natural functional role of the foot in your movement from both a sensory perspective, a mobility perspective, a strength perspective, a fascial perspective. So those that want to live a barefoot strong lifestyle, I say that you have to make sure that you're bringing sensory stimulation into your feet every day. Be barefoot every day.
Okay.
Maybe you want to do it outside, so you're earthing or you're grounding. Outside of that, looking at Naboso products, which I believe that we will mention, but Naboso products bring sensory to the feet.
Okay.
Looking at more minimal shoes, releasing your feet every day, and then strengthening your foot to core.
Okay, the concept of earthing, do you approve that?
100%.
Okay, because I Googled it last night. It was like, you mentioned in your book, just Google it. So, I just wanted to know if you really think that this actually exists and works and.
Yeah, what I would say with earthing, just like everything, is that you can't stand outside. And actually, let me take a step back for those listeners that don't know what earthing is or grounding. So our body has a charge to it. Think of it like magnets. So if people have seen magnets, like you can wear a magnet on your wrist to take care of motion sickness. So there's different things where people might have heard of magnets. That's taking advantage of the fact that we have charges in our body. So our charge, when we get inflammation and free radicals and oxidative stress, is a positive charge.
Okay.
That positive acidity, we also become acidic. Okay. So you could think of it that way as well. So the acidity or the positive charge of our body, you can oppose that or cancel that out or balance that through the charge of the planet, the earth, which is a negative charge. So, so positive, negative, kind of neutralizing each other. And there's all these kind of electromagnetic fields that you can think of. This really goes down into EMFs. So cell phones emit an EMF. So it's not that far from maybe reality that people think. But by earthing and standing on the ground, I tell people 15 minutes every day, if you can, is just neutralizing and creating a little bit of balance in your body. Now, you can't do it once and think that, oh, my plantar fasciitis is going to go away, because that doesn't make sense. It's more like I take, my potassium every day or whatever, like a vitamin, right? I drink my water every day. I sleep 8 hours. So it just has to be more of like a lifestyle. Similar to Barefoot Strong as a lifestyle. You can't train your feet one day and think you're fine. Sure. It has to be more like, I believe so much in what I preach. I definitely practice what I preach. Sure. And I've been doing it for over 10 years, and it's had a profound impact on me. It's obviously trickled over to my husband and then to my daughter and then everyone that I teach as well.
Impressive. Yeah, I mean, just a progressive overload. Same thing we do with our fitness clients. It's, just a progressive overload, like overtime. It's not a magic pill, right? It's like you got to work on it every day, a little bit.
Exactly.
Very good. Now, talking about the Naboso technology, proper footwear for high arch foot, everted, and neutral foot.
Yes. So this is where, if we look at it just in that way, saying, there's three main types of feet, which they're not, but to the listener, maybe there is, that someone either has a flat foot or they have a neutral foot or they have a high arch, which is a supinated foot, right? So there's kind of the three main ones. A lot of people and generalizations can be more towards flat feet are weaker. They they fatigue quicker. They may get foot pain easier because their muscles are weaker and they get tired faster. It's like a slower foot is the way you could think about it. A neutral foot, that's obviously in the middle. It's balanced. And then on the other side, the higher arch, the supinated foot, the inverted foot.
Is rigid.
It's rigid, yes. Now, a rigid foot is a stiffer foot, which means that it might not be able to take impact well because it's almost too stiff.
So it might not be able to absorb as efficiently?
Correct, the impact forces. So
that's a lot of impact related injuries.
Yes.
Tendinitis.
Yep, stress fractures is a big one also.
Shin splints?
Yep, shin splints as well. Both of them technically could get shin splints.
Wow.
Yeah. So if you look at it that way, in a traditional way, a lot of people, or if you go to a shoe store, they're going to say, oh, you have flat feet, you need supportive shoes. Then if you have a high arch foot, which is more rigid, you need a cushioned shoe to take away some of the impact. That's the traditional way of looking at it. The way that I try to do it is, for the most part, getting everyone into a more natural shoe and then strengthen the flat foot, mobilize the rigid foot. And then everyone meets in the middle with their minimal shoes. That's what I try to do. So that's where shoes don't become, you have a flat foot, you need a supportive shoe. It's more, oh no, I strengthen my feet so I can wear the same shoes as someone with a neutral foot. Okay. That's kind of the new way to look at it.
Okay, and does Naboso have a specific insole for each specific one, or is just a generic insole that enriches the proprioceptive properties of the foot?
Yes, exactly. And I have one here, which is.
Please show it.
So it's totally flat, right? So it's purely a sensory insole that people can see the texture across it,
yeah.
Right? And then this one actually happens to have two different textures. But the texture is bringing purely a sensory side to the foot so that you feel it more. Now, the more you feel your foot for the flat foot, you make the muscles contract and you strengthen the foot.
Okay.
For the rigid foot that doesn't do well with impact, the faster you feel your foot, the more controlled your movement is. So maybe they don't hit the ground as hard. But it's something that can be put on top of an orthotic. So if the individual is saying, no, I need an arch support, I don't want to go totally flat, that's fine. We just put this on top. So now you combine the arch support, which is mechanical, and then Naboso, which is sensory. Boom, you get the best of both worlds.
Unbelievable. Fascinating. Wow. Impressive. Okay, now this is probably the most important part of the whole show. Foot to core integration exercises that everybody can do at home.
So short foot.
Okay.
Short foot, absolutely. Again, that is the one that is pushing your toes into the ground. By far one of my favorite exercises. Another exercise is just a single leg balance. So just standing on one leg. If you stand on one leg and slightly bend your knee, so don't be locked out like you're doing a tree pose in yoga, slight bend, which destabilizes your leg and requires the muscles to contract. You will inherently contract your foot muscles without thinking about it. You have to. Third one is there's this exercise where you put a ball between your heels and you do a calf raise while keeping the ball between the heels. That's a really good exercise also to strengthen the feet and the foot to core. Those are my three big ones.
Awesome. Impressive. Okay. Now, practical tips for people to get used to walking barefoot at home.
Okay. So I like to release the feet before doing any barefoot movement. So that wakes up the nerves, that wakes up the muscles.
Myofascial rolling? maybe?
Yes. Yep. On the bottom of the foot.
Does it have to be with a ball, or can we use the foam roller for that?
No, you want to use something small. Yes.
Okay.
So I would say either a golf ball, lacrosse ball. We have a new product at Naboso called the Nero Ball, which are two domes that it's a ball that splits into two domes,
Okay.
but something like that. Okay. So you're releasing the feet for several minutes, and then that's waking up the nerves, waking up the muscles, and then you're doing your barefoot movement. Now, if someone literally is used to wearing their shoes all day, every day, then I would say just start by doing your everyday walking literally around the home. But if you can start to incorporate some of the exercises that I had mentioned, where you're pushing the toes down or you're balancing on one leg, I like to have people do these when they get ready in the morning or cooking or doing the dishes. Is if you're going to be standing in one place, could you do it by standing on one leg? That's a great way to do it.
Awesome.
Yeah, or release your feet and brush your teeth. Sounds crazy, but you're going to do it if you do it simultaneously with something else.
Very good. Very good. Okay, that's the how is it called? A habit stacking, like creating a new habit from one that's already there. Like it's easier for people, and also from a cue perspective. Like, okay, every morning when I brush my teeth, I'm gonna do short foot at the same time, and foot to core activation, and activate my pelvic floor muscles.
Mm-hmm. I love it. I might actually use that habit stacking, if that's okay, Carlos.
Yeah. Awesome. Okay, now getting into the Q's and A's very quickly. We're running out of time. Erica is asking how to deal with plantar fasciitis pain and what insoles to use.
Okay, so my big thing, my short answer for plantar fasciitis is the first one. You want to know how long you've had it for. So if this question was, oh, I've had it for a couple weeks or maybe 4 weeks, that's a little bit different than you've had it for 6, 7, 8 months. Okay. Because as soon as you get over 6 months, it becomes chronic. So it doesn't respond to what I might say as well as someone who's had it for a couple weeks or 1 month. But let's say that she's only had it for a short period. On the shorter side, you want to make sure that you're taking away the stressor that caused it in the first place. Are you jumping rope? Are you running? Are you doing burpees? Are you standing long hours in one place? So whatever it is, you have to take away the stressor. And you want to take away that stressor for 2 weeks while you're determining if this is helping it. You then want to incorporate foot release, and you want to start to address the inflammation. Maybe that is icing the foot. Maybe it's topical, maybe it is lasers or red light therapy, maybe it's CBD. There's so many things that you can do. It's a steroid injection, so many options that you can do. And then the next thing, the fourth thing, is that you do want some sort of arch support, which I'm glad that she actually asked that. The arch support that I recommend is just something cheap, over the counter, because I would want you to use it just for a short period to get you pain-free, and then we address why you got the plantar fasciitis in the first place.
Excellent. Okay. Ana Maria is asking best shoe type for weight training, and how does flat feet, back to the flat feet, affect exercising? Recommendations.
Yes. Okay. So what I would say for Anne-Marie is that focus on strengthening the foot, looking at short foot and what short foot is, start to incorporate that. And then depending on how flat her feet are, she may want to be in a minimal shoe, but adding an over-the-counter arch support into her shoe. Now, the over-the-counter arch support that I like is called Power Steps. So Power Step is one of the best over-the-counter. And then this is where you get a Power Step, and then you can get the Naboso and put both of them, and you get the mechanical, but then you make sure that you're still strengthening the foot. So a flat foot could go into any standard minimal shoe with the Power Step, the Naboso on top, and then lift weights. You could absolutely do that, and that might work totally fine for her.
Awesome. Unbelievable. Very good. Okay. We appreciate your time, Dr. Splichal, today so much. Thank you. Oh, my goodness. We learn so much every time we hear from you. Now, tell everybody, where can they find you? Social media? Tell everybody about your company, EBFA, Evidence-Based Fitness Academy, for all trainers out there, and how people can contact you.
Yeah, absolutely. So my websites, I have a couple of them. Education company that you just mentioned, the website is EBFA Global, and that is everything foot, fascial, foot core, interoception, tons of videos on our YouTube channel. So if you want to find my YouTube channel, you can just go to YouTube and probably just search my name or EBFA. Naboso, which is the textured insoles. We also have mats, flooring, and then a new release ball. That is naboso.com, naboso.com. And then my podiatry practice is my name. So dremilysplichal.com. I have so many other URLs. I tell people, if you want to just find me, Dr. Emily Barefoot, Google, you will get everything that you want. And then I'm on all the social platforms as well.
Perfect. Perfect. Thank you very much. You mentioned interoception. We got to do a show about that. That's so interesting. That takes a lot of time.
Yes, I will be back to do that. I think it's a really important topic and one that's not spoken about enough. So let's totally do it.
Sure. Next time for sure. Okay, ladies and gentlemen, thank you. We hope you enjoy this sports medicine.